And then you could take testosterone, but of course. Now, here's a disclosure. Testosterone products for women are not FDA approved. There is no official Health Canada is the HPB. Health Canada approved testosterone product for women. Does that mean that no women take testosterone in Canada? No. Does that mean that no doctors can prescribe legally testosterone for women? No. It just means that a doctor who prescribes testosterone off-label, meaning not in the official approved way, for men over 50 who are lacking in testosterone, etc., that's the official. Any doctor that does it must be familiar with testosterone for use in women, experienced in it, and must be very careful about weighing the pros and the cons. If you're doing something off-label, then you have to be uber careful with it. The risks have to be absolutely well controlled. If it was an approved thing, you could just pick up the book and say, do you meet the criteria? Thank you, bye-bye, run away. Come in, okay? You could do it. But because it's off-label, you need to have a thorough discussion with your physician about the pros and cons, the risks, the benefits, etc. So what are the risks of taking testosterone? Yeah, the hair thing. Yeah, you were listening, 5 points. Excellent. Very good. Any other risks people have heard about taking testosterone in women?
Heart attack.
Heart attack? Been heard about, but has it been proven? No. Generally it's felt it's heart neutral if you keep your levels normal, in men as well. The FDA did a study of all the research because they were worried about it. There were some reports, some studies showed men who took testosterone had more heart attacks. And then other studies that showed men who were low in testosterone had more heart attacks. So last September they came out, FDA said there's no evidence either way, pro or con. So at this stage it's a wash. Testosterone for men and women. Some studies yes and no. So, but the key point is you cannot take testosterone if you haven't had your heart attack risk checked. If you're super high risk, it might change the discussion. Okay, so here's some of the pros and cons because you're not telling them to. Okay, the pros: energy, motivation, concentration, libido, muscle gain, fat loss, and blood sugar reduction. Drops the A1C and the fasting blood sugar. What's not to like? Sounds good stuff. We should all be on it. But cons: excess muscle if you take too much. To grow too many muscles. Acne can convert, make your sebum thicker. In fact, some women take the pill to drop their testosterone so that they'll have less acne. Or spironolactone is a drug that does it. Facial hair gain we spoke about. There are drugs to block that, or it's dose related. You have to tweak the dose. Scalp hair loss, blood clots. Yes, it can make you, because it can convert from testosterone to estrogen, and in some women that have familial, about 2 to 4% of women have a familial blood clotting abnormality. And if they take estrogen, they're high risk for clots. Well, guess what your testosterone does? It becomes estrogen. There you go with a clot. You need to know that. And then, of course, breast cancer could be estrogen sensitive. Well, the testosterone might convert. So you have to have a full evaluation in all these fields. You don't just go buy it from Walmart.